Hello guys, good evening everyone. So last time we could not present this topic, which was about the soft tissue tumors around the elbow joint. So, uh, you know, I love to have my own cases and show you not just about the theoretical aspect, but the practical videos, how I operate and what are the considerations when we treat tumors around the elbow. That is what we are going to discuss today. And as usual, I would prefer that you all should ask questions and interact so that it makes the session interesting. Otherwise, it okay. So without much delay, let me start, and I'll encourage you guys to ask questions. So today what we are going to learn is the surgical anatomy, and especially what is clinically oriented, clinically important for surgical aspects when we have to plan surgery, when we have to do the dissections. And especially for tumors, it is very different because unlike, for orthopedics, where there are predefined planes, where you have to enter into internervous plane so that you don't damage the vessels and nerves. Contrary to that, I think around the elbow, what we are concerned is that we have to remove the tumors in a way that it is taken out with wide margins. So even benign tumors, you can be marginal, or for malignant tumors, we need wide margins. And elbow is a location where you know the critical structures like your brachial artery, your median nerve, ulnar nerve, posterior interosseous nerves, all will be in close proximity. So in today's topic, we will see the surgical anatomy of around the elbow. Second, we are going to see how it will be like a recapitulation of how we approach a tumor, soft tissue tumor, the basic concepts. And third will be the video demonstration, how we operate, what are the surgical planning, what are things which are in my mind when I see a tumor, when I plan my surgeries, and how I execute them. So it's not just about the planning, but also about the execution, how we start operating, and what are the structures that we see. So, guys, can you tell me how is the elbow joint formed? Anyone? Can you tell me? Any volunteer? Which are the bones involved? You can unmute yourself. Neha, I can see one from our conceptual orthopedics.
Sir, good evening, sir.
Good evening.
Yes, sir. Distal humerus. It is formed between distal humerus, radial head, and olecranon joints.
Distal humerus, your olecranon, and the proximal radius. So primarily it is the ulnar-humeral joint that gives you the movement at the ulnar, at the elbow. Now, which are the important vessels and nerves that you find here?
Brachial arteries.
Yeah. So this is important, because for orthopedics, probably you never expose from above elbow to proximal forearm. Normally it is either your fractures are somewhere here, you may see the fractures intercondylar, intracondylar, or when it is in the proximal radius like that. Hardly ever you have to make an incision which extends right from the distal humerus to the proximal forearm. But when we deal with the tumors, our incision are in such a way that we expose the artery vessels or nerve right from top, sometimes even from the humerus. We do total humerus replacements. So in that situation, we have to expose right from the shoulder joint, in fact, the scapula. We dissect out all the neurovascular bundle, the cords, trace it down, remove the humeral bone with all the attachments, and finally we articulate down till your proximal radius or proximal ulna, where we replace everything. So very importantly, the brachial artery which comes here and then it divides into two. Which are the two branches? Anyone? Anybody volunteer? So one, of course, one will be the radial artery and one will be your ulnar artery. Now, which are the important nerves which you will encounter around the elbow joint? Now, this is interesting. Let me see. Come on, guys. Why nobody is responding today? Is it too cold?
Ulnar nerve will be on the medial side, sir. And
Very good. So, we have here the ulnar nerve, which goes along the medial epicondyle, the ulnar. Where is the radial nerve? Rabi has said ulna and radial artery. Okay. Nerve, only ulnar nerve, Alpna? Anything more? Laterally radial. Okay. Can you
Median nerve.
specify? Yes, yes, please.
Median nerve.
Sorry, I cannot hear you. Can you repeat?
Median nerve.
Very good. Yes, median nerve. So here you have the median nerve. Usually it runs along your vessels. And then what else?
MBBR. Median nerve.
Radial nerve. So can somebody tell me where is the radial nerve usually situated?
Lateral most to the capital fossa.
So lateral most means, sorry, you mean here? Or here? Lateral most means here or here? Where is it exactly? How from the distal humerus, where do you find the radial nerve? Ajal, I will ask it differently. How many times in trauma?
10 centimeter above the
10 centimeter
above the elbow joint. It pierces the
Your voice is breaking. Your signal is poor. But yeah, you're going right. Tell me.
Sir, it is 10 centimeter above the elbow joint. It pierces the intermuscular septum and goes posterior.
So no, actually, when it goes down from the cord, and suppose if this is your humerus and this is your distal humerus, assume it. So somewhere here, when it starts dividing the radial nerve, it goes behind the humerus in the radial groove and it comes out anteriorly, right? So this is the course, and here it winds around the radial head at the radial neck and over the supinator muscles, and then it goes into the forearm. So many a times we assume when we are operating in this zone in the distal humerus that we won't encounter the nerve. It goes posteriorly, but actually it pierces the intermuscular septum in the lateral compartment and then it comes anteriorly. I'll show you how it is. Have you ever seen radial nerve in this location? Any one of you? Whenever you're operating? Yes, no? Just write it in the